Hello, welcome to my channel. So today we are finishing the last topic on the on the reproductive system, on the female reproductive system, where we will specifically look at the normal menstrual cycle. Okay, this is a short lecture, so we are not going to take long. Okay, so let's start. So there are some definitions that you need to know when it comes to menstrual cycle. Number one definition is menstruation. So when we talk about menstruation, we talk about the cyclic uterine bleeding experienced by women of reproductive age. And there is another definition for menarche. So menarche, this is the onset of menstruation, and the average, of course, of 12 years, but may range from 9 to 15. Others will tell you 10 to 15. So it just depends on the literature. Okay, then the average age of menopause is 51. Then the normal range is 45 to 55. And we already defined menopause in our last lecture, which was loss of ovarian function and fertility, which is characterized by amenorrhea of more than 12 months. Okay, so I know it was mouthful, especially if you don't know what we're talking about. Okay, but otherwise that's the definition. So one, someone who loses ovarian function and their fertility. Two is that they are also not going to experience menses for more than 1 year of more than 12 months. That we say now someone is having established menopause. The average menstruation is 3 to 7 days, and the average days. So in terms of the average, so 3 to 7, the average days is just 5 days. So they are usually, some people usually have 5 days of menstruation. Okay, but the average, but the range, the range is 3 to 7, average is 5 days. And the average menstrual blood loss, or just a menstrual loss, is 80 mils. So meaning if someone is having more than 80 mils, then that's now more than the normal. Okay, then someone is having less than that, then that's not normal again. So that's oligomenorrhea. So we call it oligomenorrhea. Okay, when someone is having blood loss of more than the 8 mils in short, or less than the 8 mils in short. On to oligomenorrhea. Yeah. Okay, so oligomenorrhea is when someone is having, we talk about the days, the range for the menstrual cycle. This one. So the ovulation menstrual cycle average is 28 days and may range from 24 to 35 days. Okay. So when someone is having menses more than 35 days, it's one now which we call oligomenorrhea. Okay. Yeah. So I almost confuse this. I confuse the two. Okay, so that's oligomenorrhea. Someone is having more than 35 days, so meaning they actually take long for them to occur. Okay, then if now they are taking less than 21 days, so that's why others will tell you menstrual cycles, the range is 21 to 35. So others will tell you 24 to 35. So but you usually follow the lower limit. So if the average menses are taking less than 20, they are 21 days shorter, so meaning less than 21, then that is polymenorrhea now. Okay, so meaning someone will be having a lot of menstruation, maybe in a month they're having at least 2 times. Okay, so that's polymenorrhea and oligomenorrhea. So in summary, we are saying if someone's having more than 35 days, so meaning they're taking long, that is the oligomenorrhea. If they are taking less than 21 days, because that other literature, the lower limit for the menses is 21 to 35 days, then definitely now that's shorter than 21 days, that is that is polymenorrhea. Oligomenorrhea, polymenorrhea. Okay, hope you have gotten the two. Okay, then let's go back to our loss. So this is what we call menorrhagia. There's there's menorrhagia, polymenorrhagia. Okay, so menorrhagia is of course heavy or prolonged menstrual bleeding, that is menorrhagia. So if someone is having actually has more than this, more than 8 mils or more than 7 days, that is menorrhagia now. Okay, so hope you know at least you have gotten some of the differences or some of the disorders of menstruation. Okay, so I think that's all. We can move on. So I wanted just to tell you a recap or some things on the disorders of menstruation. Okay, so let's now go to the actual work now. Okay, so in terms of anatomy, you have to know that menses don't usually start just spontaneously. Of course, there is physiology that is involved. Okay, so there is a physiology that is involved. Okay, so the hypothalamus is the one which induces or is the one which regulates hormones in the body, in the human body. So that same hypothalamus is also responsible for regulating hormones that are produced in the anterior and the posterior pituitary glands. Okay, so meaning actually the follicle stimulating hormone and luteinizing hormone are also regulated by the anterior pituitary gland, specifically from the hypothalamus. So the hypothalamus will induce the anterior pituitary gland. Okay, so now you are getting something. Okay, that's the anatomy. Then the pelvic organs, in terms of how they are, so this is the pelvic organ, and specifically this is the internal female reproductive system. This is one I really like to ask people to draw. Okay, so fallopian tubes, ovaries, endometrium, uterus, the vagina, and the cervix ear, the uterine fundus ear, the ovarian ligament, then the round ligament, the broad ligament. That's how it is. Okay. Then there are 4 hormones involved in menstruation. Number one, we have follicle stimulating hormone. You have luteinizing hormone, estrogen, and the progesterone. These are the hormones that are found or that we have specifically. Okay, so that's the things you have to know for now. So let's make progress. Okay. Then the menstrual cycle, which is typically, of course, 28 days, has 2 phases. We have the follicular phase, where the ovum is inside the follicles. Then you have the luteal phase, where now the egg has exited the ovary. Then what is left here is just the corpus luteum. Hope at least things are making sense now. So in short, we are saying there are 2 phases of the menstrual cycle. We have the follicular phase and the luteal phase. So these are the 2 phases that are found or that we have in the menstrual cycle. Okay. Then let's start with the menstruation. Let's start with the follicular phase. So from the follicular phase, we have to understand that the hypothalamus actually it releases an hormone, which is gonadotropin releasing hormone, which goes directly on the anterior pituitary gland, and it stimulates the anterior pituitary gland to produce hormones. Then those hormones, number one, follicle stimulating hormone. The other one is luteinizing hormone. Then follicle stimulating hormone stimulates development of follicles. Then luteinizing hormone actually causes ovulation. So on day 14, there is a stage of luteinizing hormone that produces which induces ovulation. Okay, so follicle stimulating hormone will go on the ovaries to stimulate development of the follicles. That's the follicle stimulating hormone. Okay, so in short, we are saying this is where we are now. So the follicle stimulating hormone will go on these are the follicle. So there will be stimulation of the ovaries to produce follicles, and follicles, the follicular cells, we have the follicular cells and the granulosa cells. Then the granulosa cells will produce the estrogen. Okay, so that's what happens during the first phase, the follicular phase. And follicular phase starts from when someone is having menstruation, on day 1 of menstruation. Then after 5 days of menstruation, the follicular phase still continues up to day 14, where there is now a surge of luteinizing hormone and someone actually has ovulation. So in short, when someone is having menstruation, that's also during the period of follicular phase. So meaning there is overlapping between menstruation, as in the active bleeding, and the follicular phase. The menstruation just takes 5 days, but the follicular phase reaches all the way from uh, the first day of menstruation to 5 days and all the way up to 14 days of ovulation. Okay, so since we say there is production of estrogen, so we also need to know about the effects of estrogen. So estrogen is the steroid sex hormone, and it's also the one which is responsible for female characteristics development, such as the breast development, the vulva, the vagina, the uterus, and the endometrium. So specifically, we are talking about during, of course, puberty, where there is development of this to maturation. Then the other is it thins cervical mucus. Okay, these are the effects of estrogen. Then, if the body has enough estrogen inside the human body, there is going to be a negative feedback. So a negative feedback has to set in. So that negative feedback will go on it will be detected. So the rise in estrogen, they are more than required, will be detected by the hypothalamus. Then the hypothalamus, after detects that okay, there is a lot of estrogen, is going to reduce the production of the gonadotropin releasing hormone. Then if there is less gonadotropin releasing hormone, then there will be no stimulation in the anterior pituitary gland. So meaning there will also be less production of follicle stimulating hormone and less production of luteinizing hormone. Then less follicle stimulating hormone, then of course the follicular cells, the granulosa cells won't be stimulated to produce estrogen. That's the negative feedback we're talking about if there's a lot of estrogen in the human. Okay, but this is in females. Okay, so uh, follicular phase. So on day 14, we say there is ovulation, of course. So what really happens? So remember, we started from the hypothalamus inducing the gonadotropin releasing hormone to stimulate the anterior pituitary gland. But specifically, on day 14, there is actually a surge of luteinizing hormone. So meaning there is a lot of luteinizing hormone. And that surge of luteinizing hormone causes the follicular phase, causes ovulation, where now there is a rupture of the follicle to produce the mature follicle, which we call the Graafian follicle. So meaning there were about 15 to 20 follicles that were what were induced. Okay, and only one dominant one is one which is going to be produced, and that dominant one is one which we call the which we call the Graafian follicle. Okay, then that's under ovulation. Then after ovulation, estrogen will also actually be reduced in terms of the levels of estrogen in the human body. Okay, so that's the thing which you have to understand. Okay, so let's I think let's move now. Okay, so let's go to the luteal phase. The luteal phase. So luteal phase again. Remember, we said if there's a negative feedback, then again, of course, after the negative feedback, then of course after the egg has been released inside the or has been released and taken up by the femur, there is going to be a structure which will be formed after rupturing of the follicle or after release of the egg. Okay, that structure is called the corpus luteum. So that corpus luteum actually produces progesterone. Okay, then the progesterone it produces the progesterone for 4 months if someone is pregnant. So meaning if someone is pregnant, it will produce progesterone for 4 months. And that why 4 months we are saying, so meaning the progesterone is also produced by the placenta. But now since the placenta is immature, it takes 4 months for the placenta to mature. So that's the time the corpus luteum will be actively producing progesterone. But if someone is not pregnant, then the corpus luteum will just stay there for 9 days and becomes the corpus albicans, then decay now, regenerates to be specific. Okay, so this progesterone, I like to call it the easiest way I remember it in terms of function. I just say it's the hormone of pregnancy. So progesterone, P for pregnancy. So progesterone is the steroid sex hormone, and it's released from the corpus luteum after ovulation. Then it is also released from the placenta from 5 to 10 weeks. So meaning, like I said, the corpus luteum, the placenta matures after 4 months. So meaning after 4 months, the corpus luteum needs to stop this producing progesterone because the placenta is now mature. So from 5 to 10 months, but specifically we say the placenta is mature at 4 months, then the corpus luteum degenerates. So that's why they have put 5 to 10 weeks. Okay, then so meaning you need to have a range, of course. Then the other function is that the same progesterone thickens plus maintains the endometrium. Then it also thickens cervical mucus. Then it also increases the body temperature. Then for thickening the cervical mucus, I remember a student once asked me where they were confused with estrogen and progesterone. Which one thickens cervical mucus? So I told them the way I remember them to say, look, progesterone is the hormone of pregnancy, and thickening the cervical mucus is supposed to be done in someone who is pregnant. So if they are pregnant and the cervical mucus is thickened, it prevents the entry of even bacteria and other infections or any foreign things into the uterus. So since someone is pregnant, okay. But for estrogen, since someone is not pregnant and they have to have ovulation, they have to have menses thereafter, then of course the cervical mucus need to be thinned. So estrogen thins cervical mucus, whilst progesterone thickens cervical mucus. What we discussed. Okay, so what if someone is so if someone is fertilized, so if the ovum is fertilized, okay, so not if someone is fertilized. So if the egg is fertilized, then the hormone human chorionic gonadotrophin, which is HCG, is produced and it maintains the corpus luteum. Then remember again, we say the corpus luteum is maintained until the placenta starts to produce its own until the placenta starts producing its own progesterone. That's what we said. Okay, so I think let's move on. So this is what we are saying. And so if someone is fertilized, of course, then estrogen, progesterone is going to skyrocket. So meaning there will be a lot of progesterone in the body, whilst estrogen will start to decrease again in the human body. Okay, so this is what we are talking about. So now if someone is not fertilized, so what will happen is that there will be decrease in progesterone, and also since at this landmark there's also a decrease in estrogen, and the endometrium breaks down, of course, if someone is not fertilized, and it gives a negative feedback where there is no gonadotrophin release, there is also no follicular stimulating hormone release. So at this stage, the body focuses on breaking down the endometrium, specifically the function layer of the endometrium. Okay, so otherwise that's what we discussed in the menstrual cycle. At least we have given you some ideas, not even ideas, we have given you the everything you need to know on menstruation. I don't think I've left out a lot of things, just the type of cells which produces what, but the reason why I didn't go through is because we discussed them during the last lecture on the female reproductive system, where we discussed about the thicker cells and the granulosa cells. Okay, so this is what we are just talking about. So this is the graph now. So 0 to 14 days, that's the follicular phase. Then for more than 14 to 28, that is the luteal phase. Okay, so that's the luteal phase. So meaning menstruation also occurs during up to 5 days. That's where menstruation is going to occur. Okay, and if you have seen, this graph is showing the endometrium. It is being broken up. Okay, so that's what we are referring to. Okay, then in terms of hormones, estrogen is usually high. Then after ovulation, it starts to drop. Then progesterone is usually low. Then after ovulation, then it starts to skyrocket. Okay, so that's what we are referring to. Then for luteinizing hormone, if you've seen it's usually low, then before the 14th day or on the 14th day, on the 12th day up to the 14th day, then it's going to skyrocket and cause ovulation, then again goes back to its usual levels. Okay, so again, some of the things that's like asking me are the safe days. So they ask, what are the safe days? Is there a such thing as safe days? Okay, the thing is it's there. So I'll just give an example. So this is in November. If this is in November, let's say someone had menses in on 22 on 22 someone had menses on 22 October. So 22, they was the one. So meaning 26 will be day 5. Their menses are done. Okay. Then just add 9 more days from 26. So 27, then October as 31 days. So of course ovulation will be on November 5th. Okay, so meaning the safe days will occur after menstruation. Okay, so meaning 27 and 28, 29, then 30, then even 31, though you can just end on 30. Okay, so the safe days usually, me, I just like to put them as the safe days, I like to put them 8 days before ovulation, but you can go as low as 5 days before ovulation, because we put in the fact that sperms can survive in the female reproductive system for up to 5 days. So you can even add a grace period for 7 days or 8 days. So if someone is having menstruation, let's say their ovulation is on day 5. So then our day 5 here, it will be like the 14th day now of so the 5 will be here. So just remove, to be specific to be safe, just remove, can even go all the way from 5, then 4, that's 2, then 3, 4, 1, 5, then 31, 6, 37. So meaning at least 3 days after menstruation, then those are the safest days to be specific. So 3 days after menstruation. So meaning if the menses ended on 26, the safe days will be 3 days thereafter. So 27, 28, and 29. Okay, those will be the safest days. Then that's all there on the phases before ovulation. So meaning just after menstruation. So meaning just here, when someone is on the 5 here, that's the 5. So just add from 5, 6, 7, then 8. Okay. So 5. So let me repeat. So 5. Someone was having menses. So 5. Then on day 5, then day 6, day 7, and even day 8 you can add. Okay, then we said 7 days before the 14th day. So 14, 2, 3, 4, 5, 6, then 7. So you've seen starting. So from 5 to 8, that's the only safest days we have, from 5 to 8. So after menses 5 days, then 6, 7, 8. That's 3 days. So 6 day 1 of safe day, 7 day 2 of safe day, 8 day 3 of safe days. Then 9 going up to 14, those are non-safe days. Okay, then what if after menstruation? Which ones are the safe days? Again, I just do the same thing for me. That's really helpful. So 7 days after, but specifically since the egg is only survives for 24 hours, so people people speculate for 48 hours after menses. Then those are the likely days for someone to be pregnant. So meaning if someone is having menses on day 14, day 15, and day 16, these are higher chances of getting pregnant because these are fertile days. But again, just to be specific, just to be sure, you can even, for here you can even add. So yeah, before the menstruation we added 17. So here you don't have to add 17. So just add 5 days or 4 days if you want. 5 days or 4 days. So 14, 15, 16, those are fertile days. Then give it a grace period over 16 and 17 and 18. So that's a grace period. Okay, so that at least 19, then those are the low chances of getting pregnant, then going up. But again, for me, just to be specific, just add another 10, another 10 days, you can just add another 7 days. Okay, but physiologically just add 4 days, then you are safe. So in short, let me just repeat what I was saying. So I was saying that for the safe days is 3 days. So after menstruation, the safe days are 3 days after menstruation. So meaning if someone is having a regular 28 days of menstruation, so meaning this is a regular, and those ones who don't have regular menses. So we are saying if someone stops having menses on the 5, so meaning the safe days will be the 6, the 7, and the 8. Those are safe days. So meaning the 9 going up the way up to 14 on their menstruation, those ones are not safe days. Then after ovulation again, the egg survives for 24 hours, but we also give it a grace period of 48 hours. So meaning a grace period of 48 hours, then the egg was supposed to have to have died and regenerated and degenerated. So meaning the 16, we expect the egg not to be there. So the 17 is considered the safe day, but physiologically you may want to give the body chance to also add another 2 days. Okay, so 16, 17, 18. So meaning at least these 18, then 19 will be your safest day, going all the way up to 22 again, all the way until someone is having menses again. So you can even add 7 days from menstruation is fine. So you can even add 7 days from menstruation, it's also fine. So I mean, if you add from 14, the day from someone had menses at the ovulation on day 14, if you add 7, it's going to give you 21. So you are going to have 21, 22, 23, 24 up to day 28, then that's when they're going to have menses. Those are a lot of safe days. That's why I prefer, the easiest way to put it is 7 days before ovulation and 7 days after ovulation, or at least this is the easiest way. 7 days before ovulation, 7 days after ovulation, or 3 days or after menstruation. Those three days are safe. Then again, after those 3 days, you wait until ovulation. Then from ovulation, 7 days after ovulation. Then so how can you know which one are your ovulation days? So you can use an application. So and now there are a lot of applications for that. So there is one which I use on patients, those ones to conceive. The flow is called flow, FLO, but of course there are a lot of apps such as that one. So at least it gives you accurate information. No, of course not at 900%, but at least it's 98% accurate. Okay, so that's a recap. The structures we talked about. So hypothalamus, the hormone we talked of in the hypothalamus was gonadotropin releasing hormone. The anterior pituitary gland, after stimulated by the gonadotropin releasing hormone, it releases follicle stimulating hormone and luteinizing hormone. Then FSH stimulates the ovaries to produce follicles. Then follicles will have the granulosa cells, and the ovaries will produce estrogen. Okay, then after, of course, ovulation has taken place, then the follicles rupture, then they leave a structure which we call the corpus luteum. That corpus luteum produces progesterone and also cause some estrogen again. Okay, and when someone is pregnant, the embryo is one produces human chorionic gonadotropin, and the HCG is one which now maintains the corpus luteum for more than for 4 months. Then from 4 months there, then the placenta has matured, then it's going to start producing its own progesterone, and the corpus luteum needs to degenerate now. So it will turn into a corpus albicans, and then of course degenerate. Okay, and from if you have seen the urinalysis, the urine dipstick, the urinalysis, the pregnancy, the Grav index, they call it the urinary Grav index, urinary pregnancy test. So in that test, you usually detect for this hormone, human chorionic gonadotropin. Okay, now in urine. So that's the hormone we detect. So meaning if someone is having this hormone, it means they are pregnant. That's what we just detect for. So that's the pregnancy test. So the pregnancy test, the urine pregnancy test, or the serum one. So the serum still will detect for the serum HCG. Urine will detect for the urine HCG to know whether someone is pregnant or not. Okay, so that's the end of the video. If you haven't subscribed, please subscribe and the bell notification, and see you on the next lecture. So next lectures we are going to have the nervous system. So we talk about the central nervous system, the peripheral nervous system, the autonomic nervous system. Okay, so